Hi, today we will be talking about the new IOL simulator from SPM Systemi. With us, Dr. Luca Vigo from Advalia Clinic in Milan.
Hello, everybody. Yes, I'm Luca Vigo. I live and work in Milano. I am an ophthalmologist, and in my practice, I do cataract and refractive surgeries.
What is your opinion about the future of cataract surgery?
I think that cataract surgery is becoming more and more a refractive procedure. Patients are really demanding and they want to correct also refractive errors and not only the opacification of the lens. So that's the reason why now many lenses are available on the market and and there is a possibility to treat not only refractive errors like myopia, astigmatism, or hyperopia, but also presbyopia. These lenses are called premium IOLs. And now I think that are probably the future of cataract surgery.
Why the Visionaire IOL simulator can be helpful in your daily work?
The idea to develop IOL simulator was because there was the need to show our patients how could be the outcomes after the cataract surgery. I mean, I think that sometimes it's very difficult to suggest a specific IOL to a specific patient starting from a specific patient condition. And so having a device that allows us to be able to show what will be the outcomes after IOL implant, it will be a great opportunity for us in order to be able in a very easy way to suggest this kind of IOLs, and from the other part, I mean from the part of the patient, to understand how will be the results after the implant. And you know that this is very important because, as I told you before, sometimes we are not promoting this kind of lenses not because we are not able to do a cataract procedure, but we don't know exactly what to say, what to tell our patient in order what he will able to achieve after the implant, what will be the advantages, but sometimes also the side effects using a specific IOL. So IOL simulator, I think that is very important in our practice because it is able to let the patient understand the results in a very easy way. And so this leads us to have a faster visit and reduce the timing of our discussion with the patient before the surgery.
And how the simulator can help you during IOL consultation?
IOL simulator, I think, can help us and our patient in a very easy way because using a very common device like an iPad Pro, this is the latest technology. I mean, for Apple company, I think that using this device, the patient may understand, and using the camera inside the device, the patient can understand exactly, trying to focus different objects at different distances, if he will be able or not to focus and to see in a very sharp way and very clearly at different distances using different IOLs. And of course, another important issue is that this may be not because he sees preloaded images inside the software, but directly trying to focus different objects and in different light condition. Also, he is able also to understand what are the photopic or dysphotopic effects that are common using this kind of sometimes this kind of premium IOLs like multifocal IOLs. I mean, the patient in some condition of light is able also to see what are halos around lights or what is glare, and may understand if he will accept this condition or not using a specific IOL. In other terms, if the motivations and the expectations are enough to accept sometimes the fact that if he will be able to read for near very clearly, he will also accept the halos around lights when he drives a car during night.
Are you using the simulator in your clinic?
Yes, of course. Since the first time that I have the opportunity to try the instrument, the device, I've been using it in all my practice, in all my pre-op evaluations. I mean, pre-op cataract evaluations, and the patients are really very satisfied, and they say that the device and what they can get from the device is really trustful. I mean, the reality is it's very similar to reality. Yes, we know that it is something that is not perfectly the same as it will be after the surgery, because sometimes there are some variables, some conditions that can change what they get from the device, the outcomes that can be shown by the device. I mean, for in case of a very intense opacification of the lens, probably the patient will not be able to understand exactly what will be the outcomes, or in case of very small pupils or very particular conditions. But what they say is that it is a very good simulation of they will get of what they will get with the surgery.
What advantages does the simulator bring to your work?
I think that IOL simulator brings us a lot of advantages, because as I told you before, IOL simulator gets and leads the visit both from our part and from patient part, and if you have an optometrist from optometrist part, much more easy and more and faster sometimes, because especially in my clinic, where I have some optometrists that prepare the patient for me before the visit, they usually discuss with the patient about the opportunities that they can have with the cataract surgery. Of course, I decide which is the best lens that I can suggest to the patient, of course, but in this case, my optometrist shows exactly what the patient can get from the surgery, and so for me it's much more easy to suggest this specific lens to the patient. So that means that when I visit the patient and so I spend some time with the patient, this time is less than before, because the patient is really prepared, and so he knows almost everything about what will achieve after the IOL implant.
Are your patients satisfied from the simulation?
Yes, as I told you, patients are really satisfied, and they say that it is the best opportunity, the best potential simulation that they can have before the surgery. You know that sometimes it's very difficult for the patient to understand what will be the result after surgery. I mean, you know that if you are myope and sometimes it happens that the patient, the myopic patient, comes to you and says, yes, doctor, I'm myope, I see very clearly for near. Now, changing my lens, so doing the cataract surgery, I want to see for distance because, yes, I'm ready. I'm able to see for near because I'm myope. And it's very difficult to let him understand that if he will no more myope after the surgery, also because you are choosing a monofocal IOL, he will not be able any longer to see for near. And so with this device, setting the parameters at the beginning of the evaluation of the trial, you can show exactly what will be the results after. And so he will understand that if he will choose a monofocal IOL for distance and not for near, and so he will correct myopia, but with a monofocal lens, he will not be able any longer to see for near without glasses. And so I think this is very, very, very important. And so I can say that patients, yes, are really happy to try and to use this device.
Well, from your words, it seems that the Visionaire IOL simulator is bringing many advantages to your surgical workflow.
Yes, it is. Yes, it is. Now we use every day IOL simulator in all our pre-op cataract evaluations. And I think now it is very important. I can add another little thing because I think it's very important also by a legal point of view, because you know that every time we have to do a surgical procedure, we ask the patient to fill in a informed consent in which we explain what we will do and what he will get after the surgery. And so having the possibility to show directly to our patient what he will get from the specific IOL implant, I think that this will be something more that we can add to the informed consent before our surgery. So yes, it is now a very important device that I think that almost everybody should use after this cataract surgery, and especially using premium IOLs.
Thank you, Luca, for the valuable information you share with us today.
Thank you very much. Thank you. Bye-bye.